Hi, my name's Caitlin Couch.
And my name is Megan Kirchner, and our report is about social media and healthcare.
We find this topic pretty interesting because we're both pharmaceutical business majors and have marketing concentrations. And in today's world, social media has become an important part of marketing.
We see the importance of social media and healthcare growing in the future. What then is social media? Social media is defined as forms of electronic communication through which users create online communities to share information, ideas, personal messages, and other content, such as videos. Social networking, on the other hand, is defined as the creation and maintenance of personal and business relationships, especially online. With that being said, social networking can take place using a social media platform. Different entities of the healthcare system can benefit from the use of social media. There are many parts of the healthcare system already starting to use social media to achieve a number of important tasks. This report will explore the importance of social media in the healthcare industry with a specific emphasis on the government and medical institutions, hospitals, and consumer sectors. Social media has not always been a pertinent part of marketing. Hospitals were not always the healthcare cornucopias of the United States healthcare system. As competition grew, marketing started to find its way into the importance of the survival of these organizations. Before 1975, however, organizations were faced with a no advertising rule, so they could not contact consumers in a way that could be considered soliciting. Social media was not the original way hospitals began marketing to patients. Rather, they used paper, radio, and television advertisements. Now, social media can be used as a large part of marketing for an organization if that organization so chooses. Many people and potential patients use this platform to connect to others for many reasons. It is said that 2/3 of the world's internet population blogging site and the sector now accounts for almost 10% of the internet time. Social media has the opportunity to play an even larger role in each market, but the focus of this paper is the role social media has and will be having in healthcare. Social media has already begun to bring patients and physicians together. Because of constant contact and up-to-date information, patients have even more trust in their healthcare providers. With all that being said, social media is now playing an important role in the healthcare system. Many patients will seek information from peers on social media sources. Through posting about health concerns, they are able to reach out to their network to uncover and possibly use the knowledge of others. These others could simply be friends and family, but also groups of individuals with the same condition or medical disease. Different social media platforms that are being used include Twitter, Facebook, and blog sites. This means that word of mouth is very important in the consumer decision-making process. With the connectivity in today's market, word travels very quickly. Patients can now research information about physicians and healthcare organizations before seeking treatment. These decisions are often based on information received through word-of-mouth tunnels, such as blogs and posts on social media sources. The internet is now the most widely used resource for health information. Hospitals and other health systems are able to use these channels to benefit their organizations. Because healthcare and social media are both so personal, health organizations have been able to take advantage of the opportunities. There are a number of ways healthcare organizations can use social media, and they include educating employees, listening to consumers, joining in on conversations about healthcare, providing true value, and being timely and relevant with content. Organization representatives are able to connect with patients and keep the patients up to date on daily happenings and events. These events could be charity fundraisers, immunization drives, and blood drives, to name a few. They are also able to bring awareness to the organization. Representatives can share statistics about the organization and are able to respond to many patient questions. Patients are able to put their information on the web as they please, but responses must be made cautiously by the organizations. This involvement in a patient's well-being is another way to show the dedication to the patients and their health. Patients then are likely to put in a good word for the particular physician or office. Social media connection also creates trust between the patient and physician. The organization also becomes more accessible as a whole. Another way a part of the United States health system can use social media is to inform incumbents of national and global health. If there is a flu outbreak in a particular region, the Center for Disease Control can post using social media sites to reach those who have potential to be affected. Those reading the posts can then ask questions and be more aware of the national and global health, helping the world become a more educated place. While posting on social media, there are rules, officially and unofficially, for organizations to keep in mind. Since the communication between patients and healthcare organizations is so new, there are not many rules or guidelines in place yet. Some worry about privacy, but steps have been taken to ensure the proper practices are followed. The Ohio State Medical Association recently released a toolkit to act as guidelines for social media use in healthcare. The Center for Disease Control has also released a similar toolkit. It is important to keep the law in mind when posting information on social media. It is illegal to disclose medical records or patient conditions. This is where cautious responses must be made. In order to assess the risk, one must use the Deloitte LLP's 2014 social media survey of internal audit professionals and other executives involved in managing social media risks. Many companies are either struggling to catch up or even more concerning, have yet to begin. While 78% of respondents indicated they view social media as a moderate to high risk, 45% said they do not have a formally documented social media policy or are unaware of one. Furthermore, 69% say they do not have internal audit or risk management reviewing social media activity or are unaware of such activities.
In the social networking world, there are many advantages and disadvantages to using social media. Not only are there advantages and disadvantages for personal use, but also for use among organizations. In personal use settings, social media may influence relationships with family, co-workers, and friends. It could damage or improve reputation, or it could be used for professional marketing and researching purposes. For popular organizations, these attributes are far more critical because of the large audience organizations have on social media. When focusing in on healthcare organizations, these attributes become severely critical because of the sensitive information issues these firms deal with on a daily basis. When observing organizational social media use, healthcare organizations are the slowest adopters of this practice. However, out of this group, hospitals, specifically large, urban, non-profit, and teaching and children's hospitals, are the highest adopters. There are many reasons these firms use social media, including marketing purposes, workforce recruitment, brand management, reputation management and customer relations, consumer and patient education, health professional education and collaboration, community creation, wellness, patient and population monitoring, care management and coordination, clinical trial recruitment, research collaboration, and surveillance analysis and product development. All of these categories tie into benefits for not only the organization, but also the consumer and the general public's awareness and wellness. Marketing is a large reason for social media use. Not only can firms generate a large audience or market for their product and services, but at a cheap cost as well. Promoting business activities, projects, and news can have a positive impact on the amount of people who follow that business, which means more people are seeing the message. When companies have job postings, they can use social media for these job postings. This is a cheap and easy way instead of paying another company to recruit candidates instead. In addition, the large population reach can generate great candidate results for the company. With this, brand management can be a goal of social media use. If the company is trying to convey a certain message to their consumers about their company, they can do this through social media use because it is a direct channel to their consumers. Reputation management and customer relations through social media is a special extra step for an organization to take. Many healthcare organizations take on special products and charity events to promote wellness within the population. If these organizations post about these on their social networking sites, consumers may develop an accepting attitude of the company and think of them highly. Not only could this affect reputation, but also the possibility of these people using their facilities in the future, which would increase future sales and profitability. In addition, if a certain problem is communicated about the company, they have the option of going back and fixing it because of a simple post. Many consumers tweet on Twitter about problems with products, services, or companies, and in turn, companies tweet back at them in hopes to solve the issue. This could also impact sales, consumer forgiveness, and the potential of attracting new clients that might face the same problem. Patient engagement is the crux of social media. Social media is used for gaining attention, and companies want their consumers to be engaged in their company, which is why they gain followers and post about their business. They are trying to engage their consumers and help them understand why they do the things they do. In other words, they're educating their patients and consumers. Many healthcare organizations post about certain conditions, eating, exercise, and other beneficial activities to increase one's health. Educating patients is a proactive and preventative way to better health. If the U.S. spent more on preventative health, people would be more educated and healthcare would not cost as much. Preventing medical problems through simple posts and articles could be a healthier and better step in the right direction for the United States. Health professional education, care management, and coordination, and clinical trial recruitment are all beneficial ways for healthcare professionals to use social media. There are many established physicians and researchers that use social media to discuss new clinical trials, medicines, and other medical solutions. If healthcare professionals post about their findings, more people could be helped because more people know about these therapies. In addition, clinical trials, which usually need thousands of patients to be successful and approved, can post the need and raise the interest and awareness for these trials. The more people know about it, the more people who are willing to join the trial and be a part of the solution. In addition to these advantages of social media, healthcare organizations use this communication tool for community creation, patient and population monitoring, and surveillance, analysis, and product development. Organizations can create a community by gaining select followers and tweeting information that is relevant to them. If a person is able to follow their choice hospital or their preferred social media, they may feel more connected to them and more comfortable with them. Marketing is tied into monitoring, surveillance, analysis, and development in many ways. Social media lets companies monitor what people are saying about their company, good and bad, and make changes and recommendations to them without going out of their way. Healthcare organizations can also analyze certain trends in consumer behavior within this industry and respond accordingly. As I mentioned on the previous slide, there are many advantages to using social media. Marketing, patient engagement, education, and surveillance are key positives that businesses can take away from these services. When observing the negatives of social media, there are two large categories these details fall into: risks and barriers. The most common risks are control of message, privacy and security breaches, and ethical issues. The most common barriers include language and cultural barriers, reimbursement barriers, return on investment barriers, consumer barriers, and legal and regulatory barriers. Both risks and barriers are possibilities as to why healthcare organizations have been slow to jump on the social media bandwagon. Control of message is a large part in the negatives of social media use. When a company tweets or posts a message, anyone can respond to this posting. The person does not have to be educated, understand the message, or be qualified to respond. However, they still have the ability to because organizations do not usually have private accounts. When the company posts this message, they face both positive and negative consequences. People can either tweet or comment positive observances, or they can be negative. If negative comments are put on the internet, anyone can access them, which can make the organization negative in the consumer's eyes. No organization wants to be seen in a negative way, which is why they must be careful in what they post. Careful postings also tie to security, privacy, and ethical breaches. Before social media use was prominent, physicians and their patients maintained a strict, traditional physician-patient relationship. However, these lines become blurred when social media is involved. This relationship can affect professional judgment, but also could expose them to malpractice errors if messages are received in the wrong way. Barriers also have an impact on breaches in the organization-consumer relationship. If the message is not written in a culturally correct way, some cultures and groups of people may not understand the message or may become offended by it. This is critical within the healthcare industry because they serve every type of patient, with no regards to age, gender, culture, race, religion, etc. To reach this market, they must be ethically and culturally correct for every type of person. With our current healthcare system, many physicians are paid with a fee-for-service model. In addition, hospitals use this to rack up their hospital bills. If a physician is giving medical advice over social media, normally they are not compensated for this action. Although it is beneficial to society, it is not financially beneficial to the healthcare provider, which may take the reason to do it away in the first place. Return on investment is also a critical factor for whether or not healthcare organizations take the leap into social media. Because social media is so new, there is not specific and relevant data that suggests that social media improves the profitability of companies. There are so many factors that go into it and so many negative and positive consequences of this action that some companies do not know if there will be a positive return on investment in social media. Consumer behaviors show that social media is mainly used by younger people instead of older people. This could be an exceptional way to promote preventative care for the future of these younger people's lives, but usually that is not a healthcare organization's target market. Instead, they target older people with more severe and chronic conditions. This can be an exceptional way for healthcare organizations to connect with the older generation and get them more involved with their health. The older population could benefit the most from more interaction, communication, and support from physicians and their organizations, which is a key reason why organizations should get their older patients more involved with social media. However, these people are usually skeptical and have concerns for their privacy and security. They may feel like it is not smart to share personal information on social networking websites, which would disinterest them with the whole phenomenon. There are many legal and regulatory barriers in the healthcare industry. In most countries, it is illegal to advertise and market pharmaceuticals and medical devices. However, in the United States, it is perfectly legal and is regulated by the Federal Trade Commission. Before 2011, Facebook gave pharmaceutical companies the privilege of disabling comments on their posts. However, after August of 2011, Facebook revoked this policy and many companies deleted their Facebook pages in turn. Because the healthcare industry faces so many negative and critical comments, some organizations choose not to get involved at all. Although consumers can still post about their company, they cannot tag them within the post, which makes the post harder to find and therefore gives it less of an audience. The FDA released a guidance to healthcare organizations, specifically pharmaceutical companies, which addressed exactly how to handle special requests for unapproved prescriptions or off-label prescription use. Besides these guidelines, there is not much federal regulation on social media use. However, many companies have their own guidelines that their employees must follow when using social media.
Next, we will showcase the research we have collected about the topics of diabetes, the Cleveland Clinic, and the CDC, which were found using the search function provided on a Twitter homepage. Twitter trends can show what people are tweeting about, not only the subjects, but who they are and where they are. This is important because one issue can be prevalent in a certain area, while an entirely different issue can be important to a totally different area. We are continuing our research and hope to produce more relevant data.
So this is the data that we've collected from typing in #diabetes in the Twitter search function. As you can see, there are negative but also positive tweets regarding this issue. In the top right corner, there is an old man that is 88 years old who has been living with diabetes for 80 years. This is extremely positive for the diabetic community because that it shows that this disease isn't always life-ending. But on the other side, there is a younger girl named Jen who tweets, "Sigh, only a diabetic goes to try on a miniskirt and thinks, is my pump showing? #frustrated, #diabetes. Now you could see that people tweet their emotions or reactions from having different side effects or medicines or also conditions. And Twitter and its researchers, including medical professionals, can use this social media to find out what people are really thinking. As we mentioned before, Twitter and other social medias can have a drastic impact on relationships with family, coworkers, and anyone else involved with your life. When you tweet, people can see it unless your profile is private. So when people tweet hashtag Cleveland Clinic, you can see everything they've tweeted. Now, like earlier with the diabetes hashtag, there were many positives and negatives, and this is the same for Cleveland Clinic. Now, you see that there's a woman named Pamela that says, I love Cleveland Clinic. And then there's Shout Out Day to Cleveland Clinic. Thank you, doctors, for saving my husband's life. Now, also, there's a tweet that says, thankful for hashtag valet parking, hashtag Cleveland Clinic. This could be used by Cleveland Clinic's marketing team and also their facility directors to show that their valet parking is really working for their consumers and that they are very thankful that they provide this service during their griefful times. Now, on the other side, you can see that Turtle Hurricane tweets, hashtag Cleveland Clinic is killing my mom by delaying surgery despite stage 3 to 4 cancer. And then they ask them, the Cleveland Clinic, to fix this. Now, this, as we mentioned before, can damage an organization's reputation. If Cleveland Clinic decides to tweet back at them, this could have harmful effects on anyone who sees the tweet, including that person and their family. Another tweet that stands out is by Adam Reed Cahill, which also uses profanity, which is blocked out. This can really damage a reputation, but also Adam's reputation too, with his relationships. For our last hashtag, we researched hashtag CDC, which is the Centers for Disease Control and Prevention. Just like the last two, they have both negatives and positive tweets that associate with the CDC. There are doctors and also Twitters called Health Ranger that have tweeted about the CDC. There is some information, like that the CDC estimates that up to 80% of all infections are spread by hand contact with contaminated surfaces. A lot of what the CDC tweets is about disease control and prevention, and different facts that concern this issue. Also, they offer tips, like in the second tweet, to make healthy living easier. Social media has become an extremely popular communication tool for personal and organizational use. Not only can organizations display their message, but they can also connect directly with their current and future patients. This is important in preventative care, but also the population's wellness and understanding. Within the healthcare industry, social media is becoming more popular, but most organizations are very strict with the information they post. From what we gathered, people really do take what they read on the internet and on social media websites into consideration when they are deciding their health plan. We believe that health-related social media will continue to gain popularity and will eventually transform into a virtual healthcare world. Not only can doctors and patients interact without formally meeting, but instead can be diagnosed and treated with the internet. Although social media and networking has positives and negatives, it could greatly influence consumers in the right direction of being motivated and understanding of their health and healthcare issues around the world. Thanks for listening.